Hello everyone, I'm Dr.Sanjib and I'm a plastic surgeon. Today I'm going to talk about gynecomastia, more commonly known as male breast. So let's start with the definition. So what is gynecomastia? At the old explain, it's enlargement of the male breast. So the male breast become bigger than the what it normally should be, and sometimes it even look like a female breast. When the grades are in the higher side, it looks more like a female breast. So talking about the symptoms, basically most of the patients don't have any symptoms. Sometimes patient may complain about the pain or tenderness when you palpate the breast, but that's very rare. And many patients have the concern about the cancer that is lead to the cancers. The gynecomastia leading to the cancer is very rare, and that should not be the concern for the patients. And the biggest concern for the patient is the psychological issue, because they cannot wear the tight fitting clothes, or they cannot change the clothes in front of their friends or the peers, and they cannot do their activities, like some activities like swimming or some other stuff. This can leads to anxiety or even the depression in the worst case scenario. So these issues should be dealt with properly with the gynecomastia patients, and many patients in my experience, they have this concern. And talking about the causes of gynecomastia, how it's caused is due to imbalance of the hormones, and the hormone testosterone and the estrogen. These are the two important hormones, and when the level of the estrogen hormone is more in males, this can lead to the gynecomastia. And various drugs, like some heart medication, calcium channel blockers, or spironolactone, can cause gynecomastia. Some research has shown that the people who smokes marijuana or drink alcohol regularly can lead to gynecomastia in some cases. So how do we treat gynecomastia? Talking of the treatment, till date there is no any medical treatment available for the gynecomastia. But we have a very simple surgical procedure. Normally we do lots of gynecomastia cases every day, and it's a daycare surgery. It's done under general anesthesia, and the surgery lasts normally a 1 to 1.5 hour, depending on the grades. So basically what we do is like, first we do the liposuction. So we remove the extra fat tissues, and this will help us to do the excision of the glands quite easy. So the second step is through the periareolar incision. Just at the border of the areola, we make a small incision, about 4 centimeter incision, 3 to 4 centimeter, and we remove the gland, and then it's suture backed. And just you stay in the hospital like for a few hours after surgery, 4 to 5 hours, then you are free to go back home. So talking about the complications of the surgery, that's as any surgery has the risks for the complications, like the infection or hematoma or seroma, but there's no major complication associated with this surgery, and the rate of complication is also very rare in the gynecomastia patients, because we are not going very deep, just we are staying above the muscle. So the complication rate is very low, and we should not be worried about the complication. We can manage it very well. So that's all I'm going to talk about the gynecomastia. If you have any further questions, please feel free to call our office and make an appointment. Thank you.